I first started at the University of Michigan as a general geriatrician interested in the science of rehabilitation of older adults. And I got connected with a group of biomechanicians. From that, I developed my own research area, which is centered in the Mobility Research Center down the road on Plymouth. There we do all kinds of things related to mobility enhancement and mobility assessment. So anything related to physiological studies, balance studies, walking studies, exercise studies, we do them all. As part of that program, we began to develop expertise in these areas, and I realized, why don't I try to carry this over into the clinic? So as a result, I've started to become less of a general geriatrician and more focused on mobility enhancement, and that's the basis of this clinic that we run. So I run the Mobility Enhancement Clinic as part of Turner Clinic. This is an outgrowth of my interest in falls and mobility in older people. So we have somebody come in the door who may have trouble with falls, may have trouble with balance, may have trouble with walking, may want to improve their exercise ability, and we work with them, and it's an unusual clinic in the sense that we have a physical therapist and myself as part of the standard evaluation. There also is a standard geriatrics evaluation involving a social worker, but the focus is really on mobility enhancement, and that usually translates into people who have trouble with falls and balance. The nice thing about what we do in assessment at the clinic is we assess the older adult in things that they probably don't normally get assessed in, for example, in walking. And when I look at the patient, we look at not just their strength and their reflexes, but also things like their inner ear function, how they think, and things in the environment that may challenge them so they will not be able to maintain balance as well, or so they might fall. So it's very kind of a multidisciplinary and a broad look at geriatrics in a way that's not done, I think, elsewhere in southeastern Michigan.